Welcome all to Bio 101, or better known as Anatomy and Physiology 1, or I'm sure you're going to refer to it as A&P 1. This is an online course. It's all asynchronous, meaning that there is no uh, one-on-one FaceTimes that we will have, no required times that we will have together. We can do Zoom sessions if you want office hours or ask me questions. We could do that, but there is no required uh, times where you have to be at the webcam with me. Except for doing the exams, but that we'll get into. You'll have like a week to do that or so. Anyway, so I just wanted to welcome you all to here. This is an online course and asynchronous. So I want to introduce you to myself. So welcome to A&P. I'm Dr. Gamal. This is who I am, but let's switch over um, to who I am actually. So stop. There I am. There I am. So I just wanted to welcome you, my two buddies over here. This is to be sure that you're in anatomy and physiology. I want to welcome you all to here. A little bit about myself. I was born and raised in New Jersey, Sussex County, mainly. I was born in actually in a Newark area, but moved up there when I was 8 years old. And uh, went to high school over there in Sussex County, went to Ohio University for my undergrad, majored in pre-med zoology. Then I went into medical school. Went to the Caribbean island of Grenada and graduated from St. George's St. George's University of St. George's School of Medicine. Um, and the way we do things in medical school is that we did 2 years. The first 2 years is book work, which is kind of like what you're doing now, sitting in a classroom or at least looking through books and just studying and taking exams. So we did that with anatomy, physiology, of course, then biochemistry, pathophysiology, microbiology, and so forth. Um, then that was the first 2 years. The last 2 years, we do clinical, which is actually in the hospitals and applying all the stuff that we read about and got tested on. And we're actually working with actual patients. And I chose to do my clinical years, 1.5 years in England. Right now, England's getting a lot of publicity because of the unfortunate news about the Queen. But yeah, so I did my first year and a half of clinical stuff with patients in hospitals in England. Saw socialized medicine on both sides, doctor and patient wise. Realized it won't work in America, but that's another talk for another time. And then I did my last 5 or 6 months of clinical rotations in New York and New Jersey. I graduated medical school with all that, and I entered the realm of obstetrics and gynecology. I did that for 5 years or so, delivered 3,000 babies, lost track after that. And then I needed to step back. I needed to get some knee surgery. My mother had a stroke. She's fine now. So I had to take care of those things. And this was a good transitional spot where I wanted to sit back and take care of those personal items before I get back into the medical realm. But during that time, when I was taking care of those personal things were changing in medicine, and it wasn't what I signed up for. A lot of paperwork, a lot of where the patients were being treated as like an assembly line, like you're in a waiting room, and then they move you into another waiting room. Someone checks your blood pressure, your temperature. That person leaves, another comes in and does an exam, and then that person leaves, another one comes in and wants to ask you more questions. Like, well, who are you? And well, I'm Doctor So and So. You're the doctor. Then who is that that had their finger up my, you know what? Oh, that was the nurse practitioner. That was the physician assistant. So what was happening is that it's not what I signed up for. Things have changed. Uh, I was under the notion going into the medical field that the doctor was be spending 20, 30 minutes with the patient, at least for the first appointment. And it wasn't like that. So I was relying on other people's uh, other people's history taking and uh, physical diagnosis, that kind of stuff. I just didn't like that where it was the student or the patients were being like on this assembly line. I'd rather just do everything myself, ask the proper questions, let the patient and myself get to know each other, build that doctor-patient rapport. Now you're only spending like maybe 5 or 10 minutes with a patient, and like I said, things are changing. I'm not saying it's going for the worse or going for the better. It just wasn't what I signed up for. So during that time when I was seeing all these changes, I wanted to see what else, just curiosity, what else could I do in my medical degree? Someone mentioned teaching, and well, here I am 15 years later and enjoying it. I've been doing now mostly anatomy and physiology. I've done biology, I've done microbiology, pathophysiology, which is probably my favorite course, which is diseases and how diseases happen. But you need to know, obviously, anatomy and physiology before you get into the disease processes. Um, so I entered the medical field, or so instead of doing the clinical aspect of medicine, I'm doing the educational branch of medicine. And most of my students over the past 15 years are mostly nursing students, radiology students, or professional students, so to say. But some of them were actual nursing students when I was teaching at nursing schools. So so the teachings were now for not doctors but and people becoming doctors, although that's a small sample of what I've taught students with. But it's mostly they're going into the pre-professional medical realm, which is fine, which is absolutely fine. If we're starting to see that, uh, nurse practitioners, physician assistants, radiologists, if they're starting to be able to be an important facet into the patient care, in terms of, you know what, doctor, I've noticed the way that this patient was walking, and it wasn't in the notes. I just want to give you a heads up. Could it be multiple sclerosis, muscular dystrophy? So now they're putting more weight on the nursing programs or radiology programs, respiratory therapy, and so forth. That they're starting to not diagnose, but to understand and see what signs are significant or not, to let the more professionals who can diagnose and treat, to help them with that. So it's not about the doctor, it's not about the nurse, it's not about the um, radiotherapist. It's more about the patient and patient care to make sure that the patients get the proper diagnosis. If you do the proper diagnosis, they're going to get the proper treatment, and if they get the proper treatment, they'll live longer. So, so anyway, I'm totally enjoying it. You'll see the way I teach things that there's going to be a lot of integration of diseases in there, not to add to the stress, but more to, if I tell you about a disease, it gives the normal stuff meaning. That now I understand why, I need to know how this structure is being formed, because look at the way muscular dystrophy is, or look at the way multiple sclerosis is. I understand the purpose of these structures, let alone how it all functions. So I'm gonna use those as good examples, and hopefully, my understanding is most of you are going into the field of medicine of some sort. We usually get one or two students that are taking anatomy and physiology one as a non-science major requirement. Just giving you a heads up, this is a very demanding course. Um, for instance, you may only want to know that this here is called the humerus, which is important. But in this course, we're going to learn about the 11 parts of the humerus, which is very detailed stuff. So there is another course. I'm just giving you a heads up. There is another course called Human Biology, which is basically A&P1 and A&P2 mushed together into one semester, but really giving you the meat and throwing out the fat and gristle. Not saying the fat and gristle is important. It's just that it's more important in the medical realm, so to say. Don't get me wrong. I do also get students who are non-science majors, and they do very, very well in this course. But just get an understanding that this is going to be a little bit more demanding than certain other courses like human biology or environmental science and so forth. Okay. All right, so that's a little bit about me and where I am. Well, actually, where I am is I taught at CCM from, I think, I don't know, up until 2016. Um, and then I moved to Massachusetts, where I recently got married. And now I live in Boston. So you're actually getting this video, you're getting me teaching here at Boston. So I've been living here now in Boston for uh, well, since 2016. So, almost 8 years now. So, no, 6 or 7 years. Um, anyway, I just wanted to let you know that's what we're doing. But that doesn't matter. Now we're in this new realm where we could do Zoom sessions. I could be in Afghanistan and I could still do this as long as I've got internet access, of course. So yeah, and I do get to New Jersey not as often as I want to, maybe once every like 2 months or so. Because I still have obviously a lot of friends and family over there. I do get to see that. So anyway, that's a little bit about myself. Welcome. So now let's go right into the syllabus. So I wanted to let you know two things. The syllabus is pretty long. All right, it is 37 pages long. So that's what this is over here. My suggestion is to print out this syllabus and um, follow along as we go through this. This will probably take a good 2 hours, maybe a little over 2 hours to go through the whole discussion that I'm going to do with you. I think it's better this way. I've been doing it this way for the past number of years. I don't know. So since the pandemic started, it seems to work out because a lot of students just don't want to read 37 pages or so. So I'm doing it with you, and I think that's probably the best way to do this. Um, I do also want to mention that the first 13 pages of the syllabus is going to be a more of a departmental syllabus portion. It's got all its nooks and crannies in there. I'm not going to go over that. I'm going to go over something that's going to be more specific to our course. So the first 13 pages you might have to go over yourself. It has a lot of the CCM policies, especially for the course that everyone gets, no matter what, in terms of anatomy and physiology. So I want you to, you can read that on your own, but I'm going to start on page 14. Now, this is not a colored version. You'll probably want to print out your colored version because there is certain things that are color coded on here. This box over here is a yellow box, even though it's black and white over here. So it's a black and it's a yellow box. So we'll start off on page 14. The other thing I want to also mention to you, and again, I'm sorry, it's not, I didn't print it out in color. This here is really, really nice. This is going to be what we call the course calendar. And the first 4 pages of the course calendar is the calendar itself, where you could actually, I've seen students take this, print it out, and they get the binder. And sometimes the binders have like a clear a folder in it, right? A clear envelope, so to say. They kind of slip it in there, and they use this as their guide, at least for the month. And then they change it and put the new month there and stuff. It's all color coded. This again is not color coded, but it's really nice. It tells you all the dates of things that are due, all the things that we're starting to study, and so forth. So you can print out this. I think it's very handy. Like I said, the first 4 pages are is the calendar itself, goes from September to December, and then the last 2 pages are equally as enjoying. Um, there is a checklist here. Again, it's usually color coded, but what I have here is the date of each assignment or exam or quiz that opens. So here's the date that it opens. Um, so let me start. The first column is where it says done. It's a little place that if you want to put a little checkbox or something like that to say, hey, look, it's done. It's always a good feeling to actually put an X in a checkbox. So you have that over here. The second column is the date that the assignment actually opens. The third column is going to be the exact date that it's due. And this is what the third column is what I have this in order for. Because certain items are open for 2 days or 3 weeks or 1 week or something like that. So I have it in chronological order of when they're due, which is the third one. The fourth column is the actual name of the assignment or quiz that we're going to be talking about. And then the last column over here is notes. Notes that would uh, so you don't have to email me to say, well, quiz number 2, what is that going to cover? It's in there. It's in the notes. Or the lab assignment number 1, what is that going to include? Well, that's over here too. So the last 2 pages is a wonderful checklist for you guys to utilize. Okay, and then there's some notes over here that you can read on your own. So, okay, so I think that this 6-page course calendar and checklist is going to be a wonderful thing to add, and that you could actually follow along throughout the whole semester. Okay, so without further ado, right now, like I said, print out the syllabus. Once you do that, we'll go right into this. I'm going to start basically on page 14. To tell you the truth, page 14 and page 15, I kind of did that as like an introduction to anatomy and physiology of this course, but I'll go a little bit more into it. So let me go back now to my PowerPoint. Okay. Okay, so the first thing I just want to tell you is that there's something called an entering survey or a questionnaire. It's just a one-page thing, probably take about 5 minutes to do, not even. I mean, that's including with uh, submitting it too. But it's just to get me better acquainted to who you are. You're not my live students. I use the same PowerPoint for other things, but for my online students, as you, it's located in the syllabus folder of Blackboard, which I'll show you in a little bit about, and I'll introduce you to the Blackboard itself. You need to download it, complete it, save it as, like change the name to your name if you want to use that, and then just email to me on day 1, and you'll be fine with that. Okay. It's just little things about what other courses are you taking, what's your major, what do you want me to call you by, if your name is Steve, but you'd rather be called Steven, that kind of stuff. Pretty easy stuff to do. Okay. So do make sure you do that and submit that. All right, so the course description. This is part 1 of a part 2 of 2 parts series. The way I look at it is this is a manual about yourself. You're going to find it so fascinating. Why is my skin color different than her skin color? Why is it that I eat breakfast and then about like 30 minutes later I have to move my bowels, and if I'm not in an opportune moment to go to the bathroom, that feeling lasts only for about like 15 minutes and then it goes away for 10 hours. Well, that's something called the gastrocolic reflex. And it's just an interesting thing how that would work, and understand how your whole body works. I mean, you get a new car, and the first thing you want to get is the manual about the stereo. How do you work all these fine features and stuff? Well, that's what the anatomy and physiology is. It's a manual about yourself. Once you understand what the gastrocolic reflex is, you might think twice about having a big breakfast before you go for an interview. Okay, so it's little things like that, and I'm going to surely show you some of these things. Always keep in mind that anatomy and physiology is not a 15-week course, but it's a 30-week course. I know you guys are taking this as a 13-week course. It is somewhat accelerated. I'm not going to lie to you, but it's not as accelerated as a summer course that's 10 weeks, or some of them we also have the 7 weeks. I mean, that's really fast. I just want to give you a heads up that even though it's a 13-week course, I'm able to give you about the same time as a 15-week course. It does rush a little bit towards the end of the semester. That entails also because we have Thanksgiving break happen during that time, and I don't have anything as due dates during that time that goes from a Wednesday to a Sunday. So that kind of helps. That kind of not helps, but it also hinders how fast it goes after Thanksgiving. So I'm just giving you a heads up about that. But like I said, it's not a 15-week course. Whatever you're going to learn in this semester, it's 13 or 15-week course. You need to remember it, because you need to use it as a foundation for our second part, which is A&P2. They don't have time to go and review stuff that you learned from A&P1 because there's so much to do in A&P2. So think of anatomy and physiology as a 30-week course or a 2-semester course. It is, you're only going to get half the story over here. Actually less, and I'll explain that later. So it's highly condensed if you were taking it in the summer course, but also keep in mind that you're taking it as an online course. But I check my emails at least twice a day, every day. So if you do send me an email, you will get a response from me within 24 hours, usually much sooner than that. But yeah, and if we have to, if I can't answer through an email, I will send a Zoom invitation, and then we'll do a Zoom invitation instead, and maybe I can draw something. Okay. So anatomy and physiology 1 is broken down into 2 portions. The first third of the course is really just a really foundations before we get into the systems. A lot of the terms that we're going to learn in the first third of the course is going to be heavily used throughout the rest of A&P1 and A&P2. These are things like anatomical terminology, some basic chemistry, cytology, which is the study of cells and how the cell actually works, little bit about genetics, and then histology. Once you learn about the cells, well, what happens when you've got to make bigger structures? Well, the cells will glue themselves together and become tissues, and that's what that is. The last 2/3 of anatomy and physiology 1 is then going to be going into the systems. And we start off with the integumentary system or dermatology, or also the skin. And then we get into the skeletal system, muscular system, and the nervous system is pretty big. We're looking at, I think there's like 5 or 6 chapters on just the nervous system. So that's a pretty big one. When we get into A&P2, well, it becomes a bullet train because it's system after system after system. There is no basics over here because they assume that you've already mastered that in A&P1. So don't forget anything in A&P1. You're going to need it for A&P2. So let's talk about the 5 requirements. Since you're taking this as an online course, there's 5 requirements that you need to know. Some of them are self-explanatory and common sense, but I do want to add a few things to it just so you understand what that is. For instance, the digital device. Yeah, I understand, and you understand. We need a digital device to do an online course. But I do want to mention that a laptop, a desktop, or Chromebooks can be used for everything. Do not use smartphones or tablets for that matter for exams, quizzes, or even something called Mastering A&P, which I'll talk about. These are not compatible with that. A lot of times, if there's pictures or images in the exams, you're not going to see them. If it's a small screen and you've got to scroll right and left, up and down, you're going to be wasting valuable time doing that also. So a laptop, desktop, or Chromebook is something that can be used for everything. Smartphones you could use as your videos, or PowerPoint you want to look and study with that, that's fine. But be very wise and understand about exams and quizzes. They are not compatible with that. Internet access. Of course you need internet access. It goes with the online. I understand that. Well, make sure you do have a good Wi-Fi connectivity, i.e. make sure you're very close to your, not modem, that shouldn't be modem, but it should be your router in your house. Sometimes if you're downstairs and the router is upstairs, you're not going to have a good connectivity. So just be mindful that when you take an exam, if there's going to be poor connectivity with the internet, the clock always continues to run behind you, so it doesn't know that your internet is not very good. Okay. And also be very mindful of internet traffic. You may not want to take an exam when your brother Bobby's playing video games and your parents are both watching TV on 2 different TVs that are watching Netflix, and then you have your sister that's doing homework and using the online. Well, you got 4 or 5 people doing that, and if you don't have a fast connectivity, megabytes per second, it's going to run slow. So just be mindful of that. The quizzes and exams last anywhere from 10 minutes to an hour, so it's not, you don't need hours of it, but just be mindful of that. Also, the only browsers that you can use is Firefox or Google Chrome. Do not use Internet Explorer, which happens to be becoming obsolete and becoming now Internet Explorer Edge. And that's one you cannot use either. And for all you Apple users, I know you want to use Safari. You cannot use Safari. The Blackboard and Mastering A&P are only compatible with Firefox and Google Chrome. And again, if you do try to take an exam, luckily, most likely you're not going to see any images in the exams themselves. You're going to lose points on that. So make sure, even Apple users, you could download Firefox or Google Chrome, and you could do that. Okay. The third thing that you need is going to be a webcam with a working microphone. You have to have that working microphone. We're going to be taking the exams, and they're going to be proctored by a service called Proctor U. It's now changed its name or changed its company's name to Measure Learning. But we could still use the word Proctor U, and they actually use the word Proctor U because it has been used for so many years, and people are still trying to condition themselves to change the name when they're talking about it. So you're going to need that for the webcam and the working microphone for using Proctor U and any virtual appointments that you want to request, like during my office hours, so to say. Okay. The webcam, when you take these exams and they're being proctored, you've got to put the webcam on top of the screen. They can't be on either side of the screen. They have to be on top of the screen. Once connected to the Proctor U, you'll then need to pan your webcam 360 degrees so that I don't see anything that's going to be notes that are going to aid you for a test. All the exams will be video recorded. Eyes need to be directed to your monitor at all times. This will uphold integrity issues. No exam of mine or quiz is open book. And you may not, and you wouldn't be able to visit other websites. There's like this lockdown that happens, and I will be alerted if you try to do that. So just don't. If you do what you're supposed to, you'll be fine. Okay. And like I said, you'll be asked to pan the camera 360 degrees so that I see that there's nothing taped to your walls, diagrams, notes, charts, anything like that. And you also need to pan on either side of your keyboard to make sure there's no notes on where your mouse would be or something like that. Okay. And this reassures that not just for me, but for your classmates, everyone's doing the same thing. Okay. The fourth thing you're going to need, it's pretty easy, I guess, is your photo ID, whether it's the school ID or government issued photo ID, like a driver's license, passport, that kind of thing. Your full name must match what CCM has on my course roster. Okay, I don't want to have a different person taking the exam. Also, make sure that this photo ID is not expired. I get alerted about that. You can't use something that's expired. Let's say 2 years ago. How do I know that's you're using something that's valid or not? Proctor U will notify you where you got to display the photo ID to your screen, and they'll take a picture of it. The fifth thing that you're going to need is a lab kit. It's ordered directly from Carolina Biological Supplies. I emailed everyone a couple weeks ago about how to go about doing this with instructions. Do make sure you have this. You should have the lab kit by now, or hopefully by the end of this week. The kit is really going to include just a few things. Your A&P2 kit is pretty big, but this one, it's important to have it because you're going to have a sheep brain in there and a cow eye. And we're going to dissect them. So you're also going to have a dissecting kit, goggles, and so forth. We're not going to be doing this lab kit or using this lab kit until sometime I guess around Thanksgiving and onwards. All right. So we're looking at maybe the third week in November. You're going to need that, but it does take 2 to 3 weeks to get. So make sure you do get it. When you have it, store at room temperature. It does not have to be refrigerated or kept outside. A garage is probably the best place to put it. You don't want it to go above, like, say, 70 degrees because things start cooking up. And you don't want to freeze it because then it's going to the ice crystals in there might change the items because the eye, as you can imagine, has some liquid in it. It's not going to look the same. So don't dispose of anything until I instruct you to do that, because you may use them for other experiments later on too. Okay. All right, so the course information. Now I'm on page 18 of your syllabus. The course information, the prerequisites is that there is no science course that you need. There's certain English and math requirements that you need. The class dates, day one will be on September 14th, and the last day that you can take the final exam is a Saturday, which is December 17th of this year. It is 4 credits. The exams, quizzes, and lab reports, I'll go all into that, but the days vary, the times vary, and remote. Obviously, it'll be done remotely from your household. But the days and times will vary when they are. We'll talk about those when they're due. Again, my name's up there, Dr. Gamaro, rhymes with tomorrow, but with a G. Office hours, like I said, email me if I can answer something through an email, no problem. But if we do need to do something, where you need to talk to me live, then I'll set up a Zoom session. I can do it at night times if that's more convenient for you, or even Sundays. And I have no reservations on certain holidays. I'm sure there's some break time I can do, not a big thing, but appointments only. So just let me know if you want to have a Zoom session. The contact information, the faculty office's phone number is right there. If you can't get in touch with me for some reason, I've never had that situation, but for some reason you can't get in touch with me, you can always call up the faculty offices. They have my phone number and they can call me and let me know. I have an email address there. Do not use that email address. That email address is really until after the semester ends, when you can't get in touch with me, or I'm at a different school or someplace else. Then use that Escamar at Yahoo. If, let's say, a year or two later, you want a letter recommendation or you want to just touch base with me, I only use the Yahoo address for all my students for the past 15 years of me teaching. So that's the only thing I use for students from then on. But the best place, the only place that I want you to get in contact with me is in Blackboard. Do not use the CCM email anymore. Once day one happens, I want you to actually email me with any information or any questions through something called the Inbox BB Mail, or Blackboard Mail. Do not use the CCM mail. The reason why is because I use that for college, and I get everything sent over there from the college, from other students or other teachers. And if you send me an email over there, it doesn't say what class, in the subject line doesn't say what class it comes from. I'm teaching a number of classes. So I don't know what you're referring to, what you're missing this, you have a question about this. I got to think which class you're in. Not only that, but an email will get lost with all the other emails from college. So I'd rather you get conditioned to only email me, and I will only email you through our Blackboard course shell. That's the only thing that'll be in there is you and I. We're building this professor-student rapport. That's the only place I'll be looking for your mail. That should be the only place you're looking for my email. I'm not going to use anything else once day number one starts. Prior to day number one, if you're watching this earlier, obviously Blackboard doesn't open until day number one. So I got to deal with that until then. So just giving you a heads up. I'll show you where all that is in a moment. So again, really fast, just a summary. The 5 things that you need for this online course is a digital device, desktop, laptop, or Chromebook to be used for everything. Do not use smartphones or tablets for exams or quizzes. The internet access, make sure you use either Firefox or Google Chrome. Do not use Internet Explorer Edge or Safari. You need a webcam with a working microphone. You need a photo ID that is not expired, and the lab kit you got to make sure that you have. I'm hoping by the end of this week you do. Measure Learning, also called as ProctorU. It's a 24-hour, 7-day online proctoring service, meaning that if you want to take the exam at 3 o'clock in the morning on a Sunday, on a holiday, you could go ahead and do that. That is okay. Okay. You'll need to go to measurelearning.com and you'll need to register your computer or Chromebook for that matter, and try and do that today. You can only use Firefox or Google Chrome to do this. You'll have to download, once you register and you create an account, you'll need to download and install something called a ProctorU extension. It goes onto your browser, whether Firefox or Google Chrome, and will stay there. However, if you use a different computer for a different exam, that ProctorU extension is not on there. You're going to have to go through the process again of downloading and installing on a new computer. Okay. The instructions will be more details, but you'll see it in the Blackboard course, and I'll show you where that is. Okay. You'll also need to do mastering A&P. That's where we're going to do all our lab experiments, and it also includes the ebook, okay, or the e-text. I don't know if it's an ebook, e-text, same thing. You need to register it within Blackboard, okay? So if you're watching this before day one, you're not going to be able to do this. Do not go to masteringANP.com and do it outside of Blackboard because it's not going to work. You have to do it within our course. I've embedded Mastering A&P into our Blackboard course. So there is no course ID or anything because you're already in the course itself. So you got to do this when that time comes, okay? So again, do not register outside the Blackboard area. Unfortunately, you can't do this until day one when Blackboard opens. You'll need to have an access code. If you took this course before, and this is your second time around, you may already have an access code. You could either get it for 18 weeks or 18 months. It may have expired already because the 18 weeks went up or the 18 months went up, and then you're gonna have to repurchase it. But if it's still working, then you could still use it. You just have to type in that access code once again. Be very mindful that if you have this access code, it may expire during the middle of the semester, and you're gonna have to repurchase it again. So you got to be mindful when the expiration date. If you don't have an access code, which most of you probably will not, then you'll be able to do that within the Blackboard course. Once you do you register for an account, it'll ask you about the access code, and you could buy the 18-week or 18-month one. My suggestion is if you're going to take A&P2, do the 18-month one. It's not a big difference in the price. I forgot what the price is. We're looking at maybe $20 difference or something like that. It's not a big difference, but I would go for the 18-month one so it doesn't, it's a year and a half. You don't know, and surprises happen. You might have to take A&P1 over again. You might take A&P2 over again. Well, you have this 18-month one that keeps on going, so at least for a year and a half. Okay. If you have any questions, then you could go to masteringANP.com, but do not, I repeat, do not register for Mastering A&P outside of this Blackboard area. The textbooks. You're going to need to get the Anatomy and Physiology by Marib and Hol. This is the 11th edition, 2019. You're probably wondering, well, geez, that's like 3 years old or so. And yeah, but let's face it, anatomy and physiology has not changed for the past 100 years. I mean, maybe an itch is now an allergy, but for the most part, it's okay. This is the most up-to-date one. You'll be fine with that. If you want to get the hardcover book, you could do that at the bookstore and buy it, and probably get a whole package deal with them. If you want to just use the e-text or the ebook and not buy the hardcover book, you could do that too, and just make sure you have the access code. The lab, there is no lab manual that you need to buy. There's a free one once Blackboard opens. It's 101 pages, and we'll be referring to that. I'll show you where that is. That's where all your lab assignment reports are going to be found. And you're also going to see, we're also going to use the Pearson's Mastering A&P in conjunction with the lab manual.